Mongolian pinch method for blood sugar. Instructions for using the pinch method in the treatment of type 2 diabetes. The pinch method is said to be performed by placing the thumb and index finger of one hand just above the wrist of the other hand and then applying a slight amount of pressure to the wrist. This, according to those who advocate for the pinch method. It is said that doing this will cause insulin to be released and will result in the breakdown of glucose. Supporters recommend doing it not only when your blood sugar is high but also on a daily basis as a means of aiding in the control of blood sugar levels. Doing this won't necessarily put you in danger, but the real question is it effective? How effective is the pinch method for treating type 2 diabetes? There is not the slightest shred of evidence to suggest that the so-called pinch method is effective in any way in bringing down or resetting one's blood sugar levels. It is likely due to the placebo effect if it has any effect at all. If it does, however, the effect is likely negligible. Even though the pinch method in and of itself is completely safe, using it when you are experiencing a spike in blood sugar could cause you to delay more effective measures. This is an illustration of why you should exercise caution when considering alternative treatments that you discover online. It is not possible for simple acupressure to raise insulin levels while simultaneously improving glucose metabolism. The structure is not nearly as straightforward as that suggests. On the other hand, there is some evidence to suggest that self-acupressure, when performed in the correct manner, can raise insulin levels and, consequently, lower blood sugar. The method that was put to the test involved the utilization of traditional acupuncture points located in China, more specifically at Street 36, 3 centimeters below the patella, and a finger's width toward the lateral aspect of the tibial plateau. SP6, 5 centimeters above the internal angle of the tibia. Lift 3 refers to the level of the dorsal foot flexors that is located between the first and second fingers at the point where the bones join. KD3, which is located in the middle of the ankle and the Achilles tendon. The participants were required to undergo training in the proper application of this method, which consisted of 5 minutes of intermittent pressure being applied to each point. It was demonstrated to be effective in lowering blood sugar levels, particularly when combined with transcendental meditation and hypnotherapy. However, this method is very different from the pinch method, and it is recommended that you include it as part of a management program that is overseen by a complementary medicine provider. This person can ensure that you are performing the technique in the correct manner. Additionally, self-acupressure is not a suitable replacement for more conventional means of managing blood sugar levels. If, on the other hand, you are looking into additional ways to control your diabetes, you should think about investigating this option.